It's nice to meet you, and let me represent me. I'm vascular surgeon, PhD, and endovascular surgeon, open vascular surgeon, and phlebotomist. And when the war began, it was very challenging for us, and there was no as usual. So we get many patients with trauma, which was associated, please slide, associated with blast injury, massive tissue defects, infected wounds as well, and often no good vein was for a conduit. That's why I remember our connections with the USA, our colleagues, and in that moment we generate brand new vessels, which was a humacyte acceleral vessel for the extremity, and we no need to look for a good vein, but we have good proteins. So human acceleral vessel. It was the first time in Ukraine, because previously it was put in USA, Poland, and Ukraine was the third country. So I was the creator of this project, and in Kiev, Odessa, Dnipro, as well in Vinnytsia and Kharkiv, we put 36 these proteins. These proteins have inclusion criteria and exclusion criteria. The main criteria inclusion was no good vein, infected wound, and blast injury. And in connection with our health ministry, in humanitarian way, we get these proteins, and one of those 36 cases presented here. Here can you see a patient with superficial femoral artery thrombosis because of blast injury, and in this patient we have no good vein. That's why we get of the self these proteins and put it in the way as classical. Here you can see proximal anastomosis. It looks like an artery, like an artery. And the next, and the distal anastomosis put in a classical way, slightly. So we can see that the pulse of using of ultrasound show us a good result, and the patient is with his both two legs, because there was no way to save these legs. Slightly. Also, this period was very challenging for us, and our center is innovative center. That's why we implement in our center two brand new technologies. One of those is JetStream, Boston Scientific, which can recanalizate dead arteries which are with hard calcified atherosclerotic plaque. The first one, and the second one is penumbra system, that is for those patients which have thromboembolic complications.
So is that JetStream, is that like angioplasty?
It's like angioplasty, but when we have no chance to recanalizate, we put this one.
So is it like a stent?
No, it's not like a stent. Like a catheter with mechanic aspiration, and it's mechanically pushing this plug and aspirate. That's after that we have a good lumen. After that we can put the stent.
I see.
And the second innovative technology is penumbra system in those patients with thromboemboli because of thrombophlebitis or phlebothrombosis. And we can put the catheter right in the pulmonary artery and get the thrombus out. Just like this. To summarize, we have new technologies which was after challenging cases of heart patients in our center. And to summarize, we can see that we can use these technologies, but we have some space to have more options. So we need a good ultrasound system to check this patient to put good diagnosis. The second one, we have one very good, like a space, röntgen angiography room, but it's only one. And there are many patients in heart attack with ischemic of the heart. And but our operations, which are hybrid, which include open surgery and endovascular surgery, need more time. That's why we need CR, like a mobile CR, which will be good in that case of patients. And the last one, we have new technologies like Jetstream, like a Penumbra, and this catheter is very high expensive. Is reality of our life, and our patients, which we want to help, not often can use this device. Slide, please. And to summarize, there are no identical injuries. In cases of massive tissue defects, when there is no good way, HEV is a good way to change this way. Penumbra system and Jetstream is a new super method that save limbs in case of critical ischemia. And one word about our scientific work, because we are a scientific center. I have with my colleagues publication in Lancet, with these new HEV prosthetics. We summarize our experience and put this in a very good journal. Thank you.
Very good.
Last slide.
Thank you.
Thank you.
Thank you very much indeed. That was brilliant. With the human acellular vessels, is there a risk of thrombosis using human tissue?
It's a good question. Thank you. This protease is acellular because the technology means that these blood vessels are killed, and we have the tube 45 centimeters and 6 millimeters in diameter, and the vessels are not reacting in immune system.
They do.
It's like artery, but with its own good weight size.
Yeah, right. So you don't have an immunological or reaction?
No.
Okay. And are you doing? You've done 36, but are you doing more?
36. This presentation was in Rome in a vascular meeting, and in that time it was 3, but now it is 36.
So that's so interesting. So this experience, out of this has come innovation and better experience and improved techniques, and so I see the point about how advances have been driven for the patient care. And as you say, you're saving limbs where
the main
you would not be able to save limbs.
Yes.
That is unbelievably impressive.
It's because of our administration that push us to do new ways to look forward to some new techniques, innovative techniques, and implement it in our center.
Brilliant. Thank you very much.
Спасибо.